Okay, next question. So then after you recognize the cues and figure out what's most important, you need to analyze those cues to figure out what could it mean. You're going to have, in the example of shortness of breath, if I have shortness of breath with a fever and a productive cough, that might mean pneumonia, right? But if I have shortness of breath and swollen left lower extremity that's tender and hot to the touch, and they have hemoptysis and tachycardia, that shortness of breath, that cue is going to mean something different. And you should leave your comment if you guys know what it is. In this example of interpreting the meaning of cues, analyzing cues, we got the nurse is caring for a client with suspected chronic venous insufficiency. So which of these findings would support a diagnosis of chronic venous insufficiency? Either an absent pulse, intermittent leg cramping with exercise, ulcers on the toes with well-defined edges, or a brown discoloration to the lower extremity. So let's talk through this one. So this is something that the NCLEX loves to test, is venous versus arterial problems, because they're going to look different, and a lot of the management for this is really on the nurse. So we need to identify which of these findings would be more arterial insufficiency or venous insufficiency. And so an absent pedal pulse, if we're not getting enough blood flow to the lower extremity, we're not going to feel the pulse as well. So that's a finding of arterial insufficiency. Then intermittent leg cramping with exercise. That is also something that happens with arterial insufficiency. It's called intermittent claudication. That's because they're walking, their calf muscles are using up all of the oxygen, and they have arterial insufficiency. It can't supply more blood, so they start to cramp as that lactic acidosis builds up. Ulcers on the toes. With arterial insufficiency, the blood flow is going to be worse the further down on the extremity it is, because that's where it's getting the least blood. So with arterial insufficiency, you're going to see ulcers on the toes and really far down, whereas with venous insufficiency, they're going to be higher up on the leg, more like the ankle or the calf. So yes, you guys are right. Even if you weren't familiar with what this is, you can kind of eliminate all the other answers because you know they're arterial findings. And this brown discoloration to the lower extremities, like you can see here, is what's consistent with chronic venous insufficiency. And this happens because with chronic venous insufficiency, you have pooling of blood in the lower extremities. And our red blood cells, wherever they are in the body, they're all the time just dying, and new ones are being put out to replace them, but they have to actually circulate back up to your body, to your spleen, to get recycled. But when you have chronic venous insufficiency, that doesn't happen. And so these byproducts of normal hemoglobin breakdown leak out into the tissues, and hemoglobin contains iron, right? So this is called hemosiderin deposits. You actually have this iron kind of staining of the skin. And I like to think of it like it's rusting, like the blood is just pooling there, and so it's got this rusty kind of appearance. So very good. Although you guys kind of switched and guessed 2 or number 4. Most of you guessed number 4. And again, about 50% of our users got this correct. So very well done. The next, we're going to look at prioritizing hypotheses. So now that we've analyzed the meaning of our cue, we're going to prioritize and decide, where do I start? Because again, like we talked about, you always have so many things to do at once. And so what do I need to address first? What do I need to prioritize monitoring? What do I need to treat like it's most important? And so let me ask you guys a question. If you had a patient that just had a craniotomy, so they just had brain surgery, and they come into you've admitted them to the ICU, what complication is a priority that you're going to monitor for? So they come out of the PACU, they've just had a craniotomy. What complication do I prioritize monitoring for? A couple people guessed level of consciousness. Somebody said IOP. I think you mean ICP. All right, so let's see. I agree with you. When our patient comes out from a craniotomy, we are going to prioritize looking at increased intracranial pressure. And so when I want to prioritize my assessments, we're going to have some assessments that are more useful than others, because you guys got it. ICP is the most important thing. So which of these assessments should we prioritize? And you guys have all guessed ICP, bleeding, level of consciousness. Yes, Trisha, if they have bleeding in the brain, it's going to look like increased intracranial pressure. Lisa Bling says clear drainage from the nose, right? That might be a CSF leak. Yes, these are all things that we should be thinking about. And increased intracranial pressure is kind of the big one. This is the classic one that you're going to get asked about in the NCLEX. So which of these assessments would we prioritize? Which is going to be the most useful for us to monitor increased ICP? And it looks like a lot of you guys are guessing 4. And yes, I would agree with you. So level of consciousness, don't ever forget this. Level of consciousness is the earliest and most sensitive indicator of increasing intracranial pressure. So it's not pupils. If we're checking their pupil size and reactivity and they already have blown pupils, that's a really late sign, right? So it's too late. And level of consciousness, you can assess that from the doorway. You can look in at the patient and tell that. Whereas pupil size and reactivity, you actually have to go to the bedside, shine a light in their eyes. It's not something you're kind of always doing in the back of your mind. Presence of headache. You could definitely have a headache with an increased intracranial pressure, but you could also have a headache because you just had a craniotomy. So this isn't going to tell us necessarily that there's a complication. And then nobody selected the Babinski reflex, but yes, that would actually be more useful to tell us about a spinal cord injury, not increased intracranial pressure. So you guys got it with level of consciousness. And 80% of our users got this right. So this is one of those need to know things. So if you didn't know it before, now you'll remember it forever, I hope.